I am pleased to introduce Dr. Rijsketić and her talk on sleep and pain.
Hi, I'm Dr. Jade Rijsketić. I am a psychology fellow at the Stanford Sleep Medicine Center, and today I'm going to be discussing chronic pain, disrupted sleep, and unmanaged stress, and hopefully provide some really practical strategies that you can use at home to break this vicious cycle. So per the International Association for the Study of Pain, chronic pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And naturally, this is impacting your thinking, your mood, your activities, your overall well-being on an ongoing basis. And this is something we're going to keep coming back to throughout the presentation. This may contribute to difficulty feeling comfortable and also difficulty feeling relaxed. For disrupted sleep, there are lots of different ways that sleep can be disrupted. It's normal for our sleep to be disrupted temporarily in response to stressors or changes in our environment. We could be really nervous about giving this presentation or worried that you won't wake up to catch a flight. And this is actually pretty adaptive for our survival to wake up sometimes as needed. For example, caring for a newborn, or if your house is on fire, you certainly don't want to be sleeping through that. Chronic insomnia, however, occurs when there's about 30 minutes or more of unintended wakefulness, either at the beginning of the night, the middle, or the end of the sleep period. And this is happening at least 3 times a week. And this has been going on for at least 3 months to be considered chronic. Although there is plenty of opportunity to sleep, the sleep isn't happening. And this contributes to a lot of daytime distress and impaired functioning. The sleep problem really takes on a life of its own. So the strategies that we'll go over today can help with chronic insomnia, but it's certainly not all of the treatment strategies. It's also possible to have disrupted sleep related to not breathing at night. Some of you might have heard of obstructive sleep apnea or know someone who uses a CPAP or has a mask on to sleep at night. The treatment that we do for insomnia is really effective at treating insomnia, but it doesn't actually help us breathe any better at night. It doesn't sufficiently treat sleep disordered breathing. So to address this aspect of disrupted sleep, it's important to get an evaluation done at a sleep center so they can diagnose and then treat you. Some people are really surprised that they have sleep apnea because they didn't know that they had it. And they often feel so much better after they're able to breathe and sleep at the same time. It's also common for people who are taking opioid medications for prolonged periods of time to have what we call central sleep apnea. So you're also having trouble breathing at night. Circadian rhythm sleep-wake disorders occur when our body's natural circadian rhythm does not align with your social schedule. So the timing of our sleep is off. You may have experienced this misalignment when you're crossing time zones and feeling jet lagged, or it can become problematic when it's chronically misaligned, like with adolescents who biologically have a later bedtime, but are required to wake up early for school, or for people who are doing shift work. The Sleep Center can also provide treatment strategies for managing this as well. So now let's think about how these overlap and interact. So from a psychological perspective, it's common for people to feel angry, anxious, fearful, and distressed in response to chronic pain. It's also common to feel these emotions when we're awake at night and we'd rather be sleeping. This can impact our overall mood so much that we feel depressed, and it's a lot harder to motivate ourselves to do things when we're feeling depressed. Our sensitivity to pain may be heightened as part of that depression, fear, anxiety, or other kind of mood concerns. So from a physical perspective, it's common for people with chronic pain or disrupted sleep to feel fatigue or low energy, which turns into a pretty sedentary lifestyle. Over time, our muscles get deconditioned because if you don't use it, you lose it. And then when we try to do an activity, we're surprised that it's painful or seems more effortful than it used to. This leads to further activity avoidance and further deconditioning, which contributes to more anger, fear, anxiety, and distress. So it's a pretty vicious cycle. And then to make matters worse, stress that is left unmanaged can really add fuel to that cycle. We often think of stress as something negative or something that makes our lives harder. However, I think it's important to recognize that stressors are normal. There's no way to get through life without them. And they can help us feel empowered and kind of rise to the occasion as needed. But here are some examples of how unmanaged stress can make matters worse. So for rumination, this is about often dwelling on the past, which is something that we can't change. This could be related to some kind of loss that we're thinking about. For example, I can't mow the lawn because of my pain, or I can't mow the lawn because I didn't sleep well last night. For worries, we're often thinking about the future, which hasn't happened yet and may not actually be quite as catastrophic as we imagine. We're trying to anticipate threat, which is helpful, but with heightened fear or anger, our minds can make it seem a lot worse than it actually is. So you might think, I'll always have chronic pain, or my sleep is going to be terrible for the rest of my life. So with rumination and worry, this is really about our thoughts. Next, looking at poorly regulated emotions. We might be frustrated with being awake at night. We might be fearful of causing more pain. We could feel sad about not engaging in life as fully as we used to. And if we're not able to regulate these emotions, they'll continue to bother us and feel uncomfortable. Next, looking at behaviors. So it's common, unfortunately, to stop doing things that you enjoy or to spend more time in bed, which can really make matters worse over time. As a psychologist, I approach this with an understanding that our thoughts and our emotions and our physiology and behaviors are all interrelated. Everything that I was talking about the past few slides can be understood from this framework. And all of this happens automatically, whether we like it or not, and whether it's helpful for us or not. So in response to a situation, we have thoughts, emotions, bodily sensations, and behave almost immediately. Our goal for treatment is to help you identify specific thoughts, behaviors, emotions, and physiology that you want to change. And then we guide you to take a step back and notice each of these and teach you strategies so that you can change them. And it's not easy, but it does work. So I was thinking about that kind of on an individual level, but on a macro level, health psychologists work from what we call the biopsychosocial model. So our biology and our psychology and socio-environmental factors all impact us. They're all part of this kind of situation and context from that last slide. So taken together, it becomes apparent that there are several factors impacting chronic pain, disrupted sleep, and unmanaged stress. It's a pretty complex system. And some of these things we can't change, unfortunately, but some of these certainly can be changed, like coping. So these are some quick fixes that can certainly make us feel better in the short term, but can make things worse in the long term. For example, reaching for some pain medication or sleep medication can feel better in the moment, but actually kind of exacerbates things over time. Drinking coffee during the day can help us feel more alert. Drinking wine at night can kind of help us to take the edge off. And we tell ourselves to tough it out or push through to try to keep up with the demands of life or work. We distract ourselves with endless entertainment, right? Scrolling through bottomless social media, YouTube with like the next video suggestions, there's news, TV, movies, all of it's just a click away. So there's just this instant gratification in being able to do that right away. We make unhealthy food choices or kind of eat in order to feel better. And let's be real, we all do these, and they are all appropriate at times. I have nothing against chocolate cake or a good movie, but these do not need to be our primary coping strategies. So exercise, yoga, meditation, social support from loved ones, being out in nature, spending quality time with people or pets, playing games, doing hobbies. These kind of strategies help us to feel better in the short term and also help us in the long term, and therefore may be more effective as primary coping strategies. So even if you're doing all of those effective coping strategies, you could still be stuck in this chronic pain, disrupted sleep cycle. And therefore, I want to offer some specific strategies that you can try at home. These are just a few of the tools in a psychologist's toolkit. So keep in mind, this is not comprehensive, and the treatment would offer many more strategies. So the diaphragmatic breathing that I'll teach targets the physiology. Changing your mindset will be targeting thoughts and emotions, and then modifying your behaviors is obviously targeting behavior change. And just like exercising one time doesn't help you to noticeably improve your strength or your flexibility, trying these strategies one time will not help you to improve your pain, your sleep, or your stress. So I'll also cover strategies to maintain these changes over time. There are many ways for us to engage our parasympathetic nervous system and help ourselves truly relax physiologically. When you breathe diaphragmatically, your breathing slows, and it actually takes less effort and energy to breathe. You might feel a little less muscle tension or discomfort, and some people notice their mind seems more quiet. Sometimes people notice their hands and feet feel warmer, or their heart rate slows, or maybe there's a little more saliva production. So how this works is that when we inhale, our belly is out, and when we exhale, the belly goes in. Even though our lungs are in our chest, the lungs actually don't move in and out. It's the belly that's moving in and out. So let's watch this demonstration and try to follow along. Switch this over. Okay.
Now we'll do a demonstration of diaphragmatic breathing. What I'd first like you to do is put one hand on your chest and one hand on your stomach. And we're going to take 3 deep breaths, just normal deep breaths. Good. Did you feel that top hand really moving as you breathe? And when we're stressed, that tends to be the type of breathing that we engage in, is that chest breathing, where the shoulders rise and fall and there's some tension there. So when we do diaphragmatic breathing, we're going to push that breath down lower into the stomach. And instead of that chest moving, it's going to remain nice and steady while your lower hand rises and falls with your inhale and exhale. So as we take a breath in and out, you're going to breathe in through your nose and then out through your mouth, slowing that breathing down and letting that air fill your belly as it goes down through the chest and expanding the belly. And then as you exhale completely, your belly is going to let go of all that air and completely exhale out. And your breath in will be about 4 seconds, and your exhale will be a little bit longer at 6 seconds. So we're going to practice, and we'll do about 3 breaths with me guiding you. And I'll say inhale, 2, 3, 4, exhale, 2, 3, 4, 5, 6. That exhale is a little bit longer than the inhale so that we're getting all of that byproduct of our breathing out. The inhale will be nice and steady and a nice steady exhale. So you can close your eyes and get comfortable. And when you're ready, we'll take that first inhale, breathing in through your nose. Inhale, 2, 3, 4. Exhale through the mouth, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. And I'd just like you to fall into a steady pattern of breathing, continuing to breathe deeply, filling the belly, exhaling out completely. You may envision that there's a balloon that fills as you breathe in, and then as you exhale out, all of the air from the balloon is released, breathing in through your nose and out through your mouth. Maybe beginning to feel your shoulders relax. Your jaw relaxes too. And even your stomach begins to feel more comfortable. Nice, heavy limbs and warm relaxation circulating throughout the body. Just continue to breathe in a rhythm that's comfortable. Good.
Okay, so I hope that you found that relaxing. And if it wasn't relaxing for you, that's okay. It doesn't mean that it doesn't work for you. It can take a lot of practice to get used to and to feel comfortable with. So we recommend practicing for about 5 or 10 minutes, 3 or 4 times a day. Next, thinking about how to change our mindset. It's common for us to automatically have thoughts and immediately believe them or accept them as truth, which leaves little room for us to change our thoughts. I mean, why would we change them if we think that they're 100% true and accurate? As I described earlier, our thoughts are closely related to our emotions, which impacts our mood, which impacts us in multiple ways, and can interfere with our enjoyment of life. So the first step in changing our mindset is recognizing that not all of our thoughts are 100% true. We notice them and then proceed to question them, which helps us to think new thoughts. In other words, we catch the thought, check it, and then change it. These automatic, negative, unhelpful thoughts that we have are so common that we have a whole list for different approaches our minds use to lie to us. The list is called Unhelpful Thinking Styles, and it's a tool that psychologists use in cognitive therapy. This makes it a little easier to check our thoughts. I know, depending on the size of the screen, you may not be able to read them all that well, but you could Google this and probably find a similar handout. So I'm going to go over a few examples. Your original thought might be, I'm just so tired, I can't do anything. So we caught the thought. Now we look at this unhelpful thinking styles and realize this is an example of all or nothing thinking. The key word in that thought was anything. I'm just so tired I can't do anything. That is an absolute term. And noticing this helps us recognize that's not actually 100% true. So we checked our thought and we realized it's not actually that accurate. Now we can change it. So we could say instead, I feel really tired, but I can still heat up some leftovers for dinner. And that's really different from I'm just so tired I can't do anything. Another example would be thinking, he thinks I'm lazy because I didn't mow the lawn today. This is an example of mind reading or jumping to conclusions. In reality, we don't know what he thinks unless we ask him. And it doesn't help us to assume that he is judgmental toward us. So then we change that thought. I don't know what he thinks. This actually could be a reflection of what I'm thinking about myself. And so there's lots of different ways that we can catch, check, and change our thoughts. Those are just a couple examples. Next, I want to cover some ways to modify our behaviors. And there are lots of different ways to do this. This is just a few examples. I'm going to cover each of these in the next few slides here. Bedtime routines are often thought of something for kids, but it's actually really helpful for adults to do them too. We need that time to transition from wake to sleep. So we want to mimic the natural environment by dimming lights and allowing the temperature to drop, just like it does outside when the sun goes down. By minimizing screen use in the evening, we're getting less light and less stimulation, which helps prepare our minds and bodies for sleep. We want to do enjoyable activities that are not too engaging and help us feel relaxed. The next behavior change is to keep a consistent schedule. This, as much as possible. This is really helpful. I think it's common for people to fall out of their routine. You want to go to bed early or sleep in late, and that actually makes sleep worse in the long run. We all have kind of natural variability in our circadian rhythms, and it's important to sleep at a time that works for you and stick with it. For some, this could be a 9 p.m. to 5 a.m. schedule, and for others, it could be a 3 a.m. to 11 a.m. schedule, or you could be somewhere in between. But it's important to find a time that works for you and to stick with it. Now this one can be a little, it's not super intuitive. But actually, to improve sleep, we recommend spending less time in bed. So this isn't something that usually people try on their own, but it can be very, very effective. When we're in pain, we often spend more time in bed because it's a comfy place. And when we don't sleep well, we also spend more time in bed. You want to be ready for when sleep happens. So over time, our brains learn that being awake in bed is a thing that you do. You kind of built up that association between bed and reading, or bed and scrolling on your phone, bed and checking the time, bed and thinking about how you're not sleeping, or that association between bed and being in pain. These are not conducive to sleep because all of these activities are really stimulating. So then when we decide to sleep, that's just one more thing that we could do in bed, but it's not the only thing that you do in bed, which is confusing. So we recommend spending less time awake in bed so that your brain learns that bed equals sleep. And to elaborate on that, for bed equals sleep, this means that during the day, all of your wakeful activities are happening somewhere else, not in the bed or in the bedroom. And then you're getting into bed when you actually feel sleepy, but not before your typical bedtime, because we talked about keeping a consistent schedule. And you know you're feeling sleepy, this is different from fatigue, when like your eyelids are heavy, you might kind of have like a head bob, hard to focus on things, you're just feeling really sleepy. And then if you do happen to be awake at night and it feels like it's been about 20 minutes, you're not checking the time, but if it feels like 20 minutes, then it's time to get up and do something relaxing until you feel sleepy again. So in the morning, you wake up and you get out of bed at the same time every single day, even if you didn't sleep very well. And we're using the bed and bedroom, ideally only for sleep and sex. A common question is, what am I supposed to do when I can't sleep? And you told me to get out of bed. And so we recommend doing activities that are kind of low light, low movement, low stress, things that you can easily stop or put down when you notice that you're feeling sleepy. And the most important thing is something that really promotes your sleepiness. And this is different for everyone. There's just a few examples here. For example, you could color or do Sudoku. You could listen to music. But it's really up to you to decide what's going to help you feel sleepy. And for the last behavior recommendation, I want to go over time-based activity pacing. So this is what we call the boom-bust cycle. When we feel good, we want to do things naturally, but when we overdo it, our pain flares up. And then we need to recover while we wait for the pain to subside. This leads us to being considerably less active over time. So here's an example. I spent 30 minutes doing yard work, and then I just couldn't take it anymore. The pain was too much. For the next 5 hours, I couldn't move. So how long did the yard work take? I mean, the obvious answer is, well, it took 30 minutes to do the yard work. But in reality, when you count the recovery time, it actually took 5 hours and 30 minutes to do this yard work. So we need to outsmart the boom-bust cycle. So the key here is to stop the activity while you're still feeling good. You could keep doing it, but you actually decide to take a break. And that way the pain doesn't get aggravated. You're able to recover faster. So examples of being able to recover would be doing the diaphragmatic breathing that we just went over. You're setting a time limit for your activities. Instead of stopping when you just can't take it anymore, we're stopping kind of based on how much time has passed. So a revision would be doing yard work for 5 minutes and then resting for 15 minutes. Not just vegging out watching TV, but actually doing something to engage the parasympathetic nervous system, like diaphragmatic breathing. And then you go back out and do 5 more minutes of yard work and you rest for 15 minutes. You repeat this 6 times. So you still end up doing 30 minutes of yard work. but you only rested for 90 minutes, which means it only took 2 hours. And that is considerably less time than the 5.5 hours that it took with the boom-bust cycle. And we end up feeling a lot better about it, having more time and more energy and less pain to do other things in life. And then lastly, like I said, it's hard to maintain these changes over time. So I do want to go over some strategies for that. It's helpful to consider how our goals actually align with our values. If it's truly important and meaningful for you, you're more likely to stick with it than if it's something you just feel like you have to do or you should be doing, but doesn't have as much kind of personal meaning behind it. It can be helpful to set kind of mini goals. For example, I'm going to put on my exercise shoes and step outside to get some sunshine after lunch. This could lead to a 30-minute walk, but if you tell yourself, I need to go on a 30-minute walk, you might have a larger, more daunting task than just putting your shoes on and stepping outside. It's also helpful to set reminders, particularly at the beginning. This will help you to do it more consistently, and with time, it can become part of your routine. If you keep up your routine, it becomes habit, something you do almost automatically without consciously deciding to, and then it's really part of your lifestyle. Another strategy for meeting your goals and sustaining them long-term is to be very intentional with SMART goals. So these are specific. You're stating exactly what you want to accomplish. It's measurable, something that you could actually track. Achievable. We want our goals to be reasonable, not something we can't actually achieve. Realistic, something that's really important or relevant to your life. And timely. You can kind of give yourself some deadlines and give yourself time to do it, so it's maybe still a little challenging, but not too much time. So an example would be saying, I need to exercise more, right? That's a common goal that people might have. And to make this a SMART goal, we would say, my goal is to do 10 jumping jacks and 5 sit-ups 3 times a week for the next 2 weeks. This is really specific and also something that we could totally measure. You know whether you did it or not. You know exactly how many jumping jacks or sit-ups you did. You're also recognizing that this seems realistic based on my current activity level, but will challenge me to exercise more than I have been lately. So again, it's achievable, it's realistic, and it's also timely. We set the deadline for the next 2 weeks. Here's another example. I want to practice diaphragmatic breathing more often, right? Because you just learned about doing diaphragmatic breathing. Maybe this is something you'd like to do more. So more specifically, my goal is to practice diaphragmatic breathing 3 times a day for 3 minutes each time. I'll remember to do it if I make it part of my daily routine. I'll breathe diaphragmatically in the shower, when I eat lunch, and while I read as part of my bedtime wind down. So it's becoming part of their routine, and they're more likely to do it automatically. Here are a few resources that you can use to learn more about these topics. Like I said, there's a lot more where this came from. This is just kind of a brief overview. So the Curable app is an app that's really helpful for managing chronic pain. The CBTI Coach is helpful for managing chronic insomnia. Do Yoga with Me has many yoga videos for all levels. If you want to learn more about breathing, there's a really nice TED Talk. You can look into that. It's just called How to Breathe. And this workbook, the Relaxation and Stress Reduction Workbook, has a ton of strategies for relaxation and stress reduction. I think this is a go-to for many providers. And then a few more books. Quiet Your Mind and Get to Sleep is focused on treating insomnia for people with chronic pain and depression and anxiety. This was written by Rachel Manber. She's a prominent researcher and behavioral sleep medicine specialist at Stanford. Then The Upside of Stress, also written by a psychologist at Stanford. It describes research studies and provides examples to help us better understand and adapt to stress. She also has a TED Talk, Kelly McGonigal does. And then lastly, in Emotional Agility, Susan David guides us to better understand our emotions and use them in a way that's helpful for us. She also has a website and a quiz to assess your own emotional agility.